Thank you everyone for being with us today. And yes, we are going to be talking about those prevention care that we need to do. And thank you for sharing the answers with us in the chat. So a lot of individuals start to talking and they have the curiosity of what is IFAS. IFAS is the Institute of Food and Agriculture Science, and our mission is to develop knowledge in agricultural, human, and natural resources and to make that knowledge accessible to sustain and enhance the quality of human life. We have an office of the University of Florida in every county in Florida. So yes, 67 counties have office of IFAS, and there are different research centers during the state as well. In these offices, there are faculty for the staff that we have an area of experience. My area is family and consumer science. I deal with everything that is human behavior. Of course, we are an equal opportunity institution. So we were talking about annual wellness visit. An annual checkup or visit, also called a yearly physical, is a preventive care visit focused on detecting health conditions before they appear. You can discuss any doubts or questions about your health and receive health advice from your primary care provider. These annual visits are covered for insurance. When we are talking about the physiological changes that we have, we need to main and focus in our body composition. The percentage of our body that is fat or adipose tissue increases as we age. A change that is easy for an aging person to notice just by looking in a mirror. Sadly, increased adiposity, especially abdominal fat, is associated with increased risk for diabetes and cardiovascular disease, both of which are associated with aging. Along with the increase in percent of body fat in older adults is a decrease in lean body mass, which includes muscles, bone, organs, connective tissue, and water. An important effect of the loss of the lean body mass is a decrease in energy or calorie needs, since adipose tissues is less metabolic active than lean body mass. When an extreme decrease in muscle mass is accompanied by reduction in function, diagnosis sarcopenia. We will see that adequate protein is important to attenuate the lost muscles as we age. Strength training is something that can slow down the age-related decrease in muscle mass and even increase muscle mass in older adults. That's the reason that you guys and we can see individuals going to the gym to try to do this. In addition, the decrease in bone mass associated with aging points to a need of emphasize in the adequate intake of nutrients while we are eating, related to maintaining our bone strength, including calcium and vitamin D. When we are talking about body composition, we need to see as well what are the concerns that we not related to water. I want to particularly emphasize the decrease in body water that occurs with aging. As a comparison, in infants' bodies is about 75% of water, and the body of an older person is about 50% of water. Because of this decrease in body water, older adults are at increased risk for dehydration and need to be sure to keep themselves adequately hydrated. As you can see, I have mine bottle here in my desk, even when we are inside of the office. Something that we need to check as well is since the thirst mechanism can be affected by aging, adequate water intake can be challenged for some older adults. Some older adults deliberately restrict the fluid intake, and you can guess why is that. When we are outside, it's recommended to drink water every 15 minutes. Another thing that we're going to see is the area of the tooth, mouth, and the related problems that comes with those. As people age, there are an increased risk for dental problems, such as missing teeth, gum disease, or ill-fitting dentures. Some people may not have the means to buy dentures at all, which limits the types of food they can eat and increase their nutritional risk. In fact, anything that limits the types of food that can be consumed will increase the risk of inadequate food intake or poor nutritional status. Older adults often take multiple medications, and certain drugs can cause dry mouth or mouth sores, either of which will prevent them from eating a variety of healthy foods. If this is a problem, the physician may be able to prescribe a different medication that has a less significant impact on the ability to eat a variety of foods. And in this one, going to the dentist is something that we need to do as well for a cleaning. And a few individuals goes sometimes one time per year, sometimes every 6 months. When we are talking about the addition changes in the mouth, which is the first part of the gastrointestinal or GI tract, other changes can affect the digestion of food or nutrition absorption, occurring in the stomach and intestine as we age. About 30% of people over 50 years old have a disease that is called achlorhydria, which is the low production of stomach acid. This change in stomach acid limits the digestion of specific nutrients, including vitamin B12, folate, iron, calcium, and zinc, all of which are critical for older adults. Secretion of the hormone ghrelin often decreases with aging. This hormone sends a hunger signal to the brain when the stomach is empty. A decrease of ghrelin suppresses appetite, a condition known as anorexia, which is an associated with the frailty in adults. In the small intestine, a decrease of lack of the enzyme lactase decreases the ability to digest the milk sugar, lactose. This familiar condition, known as a lactose intolerance, causes bloating and discomfort when milk is consumed. And many people with lactose intolerance avoid milk for this reason. Depending on other dietary choices, eliminating milk from the diet can negatively impact the intake of calcium and vitamin D, which are essential nutrients for maintaining bone health. Lactose intolerance is more common among Black and Asians than among whites. Another age-related change is the gastrointestinal motility, which refers to the movement of the gut contents through the GI tract. The mobility tends to slow down with aging, which increases the amount of time that digested food stays in the colon or the large intestine where water absorption occurs. When GA contents stay in the colon longer, more and more water is removed from the gut contents and absorbed into the body, making the stool hard and causing constipation. Here's where adequate hydration and consumption of dietary fiber play a role in GA comfort and quality of life. So please, drinking water during all day, that's a plus. And the first sign, sometimes when we wake up, the first thing that we need to drink is water as well. When we are talking about the loss of certain sense, we can see that in the change in taste and smell. Often occurs as people age. Not everyone experiences these changes, which are usually associated with the use of certain medications. When food doesn't taste or smell appetizing, it's challenging to have the desire to eat, and food intake often suffers as a result. People don't want to eat that one because doesn't taste, doesn't smell, it's not appealing. It's the first thing that we see, how it looks, how it takes, so we want to consume. Severely limiting food intake in terms of both the amount of food that we eat and the quantity of food can affect nutritional status and our health. Older adults who experience changes in taste or the smell that affect the enjoyment to enjoy the food is advised to consult with the doctors, because if the sensory changes are related to a medication that are taken, it may be possible to adjust the prescription. So please, so if you start to notice something like that, speak with your primary physician. Another sensory loss can be affect the food is the eyesight, which can impact the ability to purchase food, read food labels, and prepare food. Individuals with poor eyesight may also struggle to detect changes in the food that include spoilage, making food safety and concern among older adults with limited vision. An annual eye exam is critical for everyone, but especially as we people age. We need to go to have that eye exam as well one time per year. And there are certain diseases that increase the loss of vision, so we need to start to check that and for looking for glaucomas. When we are talking with the immune fusion, begins to decline fairly early in life. Older adults are at higher risk than younger adults for infections from various infectious agents. They are also more likely to have a severe illness when they become sick. This is why you hear about older adults being hospitalized or even dying during major foodborne illness outbreaks. The other cohort that can be severely affected by foodborne illness is infants, because their immune system have been fully developed. Studies of older adults who experience high levels of stress, such as those who are caregivers for a chronically ill relative, have found adverse effects in their immune function and increased susceptibility to illness. Adequate intake of protein, as well as vitamin C and E, beta carotene, and zinc is needed to help keep the immune system functioning. This does not mean that supplements are required, but the food intake should include a wide variety of healthful foods. If we are going to talk about the kidneys, they may become less efficient in concentration urine as people age, which cause excessive loss of water and contributes to dehydration. Additionally, the kidneys are essential for metabolizing vitamin D into its active hormone form, a process that also tends to decline with age. Older adults need to be sure to get adequate vitamin intake of vitamin D in their diets for bone health and other functions of this vitamin. In many people, particularly those with diabetes, this renal function change may be early signs of kidney disease that being a result of normal aging. In fact, if it is estimated that more than half of adults over age 70 have chronic kidney disease. If we are going to see what are some of those effects of psychological changes that we're going to see, you can see here in the slide: appetite, digestion of food, nutrient absorption, impacts of this in the status of health. Those factors, what they do is slower the digestion. So food stays in the stomach longer, causing a feeling of fullness more quickly. Hormonal shifts, change in hormones that regulate hunger, anxiety, fullness, how we feel full, can disrupt your body signals. Diminished senses, a reduced sense of taste and smell, can make food less appealing. Bitter and sour flavors may become more pronounced, while sweet and salty taste can decline. Dental issues. Poorly fitting dentures to loss, dry mouth can make chewing and swallowing uncomfortable. Side effects of medication. This is one important. Many medications taken by older adults can suppress appetite, alter taste, and cause nausea. Chronic health conditions, illness like cancer, dementia, thyroid disorders, and hair or kidney disease can affect the loss of appetite. Dehydration. Chronic dehydration is common in older adults and can lead to loss of appetite as well. And we are going to see this for each one. So One of these slower digestion, food stays, I already mentioned, and we start to feel more full. We don't want to eat. We lose the appetite, and hormonal changes switch that regulate how we feel it, and this can affect everything in our system and made the appealing of food less pleasurable, and we don't want to enjoy it. So that's the reason that we start to see a lot of people playing with the food and they don't want to eat because this is not satisfactory for them anymore. A few things that we need to see as well is a little depression can occur with that because the person doesn't feel good and can cause depression in this area. So your digestive system works tirelessly every day to break down the food that we consume. After years of this, you may begin to notice some improvements in your digestive health. That's because aging, although it does not affect the digestive system in the same way as some other organs in the body, is a risk factor for specific issues, including colon cancer, something that we have seen very frequently right now in the news with the younger generation, acid reflux, stomach sensitivity to medications, and decreased absorption of particular vitamins. Something that we can see as well is constipation. Our digestive system moves food through our bodies through a series of muscle contractions. As we age, this process can slow down. When that happens, more water from the food is absorbed into the body, which can lead to constipation. Staying hydrated is very important to help prevent constipation. Inactivity can also contribute to constipation. So remember to get at least 30 minutes of moderate physical activity 4 days a week. Something that is very good is when we are eating, when we finish to eat, go for a little walk, 10, 15 minutes. That helps with this issue. Medication, the medicine that we can take help with one physical problem can contribute to another. Medications taken for high blood pressure or muscle and joint pain can cause constipation. Therefore, it is essential to stay hydrated and maintain active lifestyle. Something that if you take these medications, take note that the color of the stool and tell the doctor if it's a dot or show size of blood. Something that we need to be very careful as well is with colon cancer. It is recommended that most people have their first colonoscopy by the age of 50. Now, they are recommending to individuals sometimes in the middle 20s and early 30s. This is because the risk of developing polyps in your colon increases at the age. Non-cancerous polyps can become cancerous, so it's essential to have a colonoscopy to identify and remove the polyps before cancer develops. Another issue is diverticular disease. Diverticulosis is quite common in individuals over the age of 60. It occurs when the small pouches that line the colon bulge out in weak spots along the intestinal wall. Some people may have no symptoms when this happens, while others can experience gas, bloating, cramps, or constipation. Diverticulosis typically does not require treatment. However, when the pocket becomes inflamed, symptoms may can include stomach pain, crampy fever, chills, vomiting. This can be treated with pain relievers and antibiotics and diet changes. Please mention any type of problems with your doctor. GERD. Although a person of any age can develop gastrointestinal reflex disease, GERD, is pretty standard among older adults. So someone with GERD has stomach acid that backs up into the esophagus, causing heartburn and other symptoms. Sometimes when we lay down, a lot of people trying to put pillows or trying to be a little more elevated in the upper area of the body to trying to decrease this acid reflux. A small number of individuals that have Barrett's esophagus can develop esophageal cancer. So that's the reason a few individuals, they do endoscopies. Another thing that could be happen is non-alcoholic fatty liver disease. And this is very, uh, doctors start controlling the individuals that have obesity or have high triglycerides or diabetes, are a higher risk for non-alcoholic fatty liver disease. In this condition, fat accumulates in the liver, is the common type of liver disease in the country and can cause scarring of the liver tissue. Over time, patients can develop liver cancer or failure. Although there are other sometimes no symptoms, the condition can be diagnosed with a blood test or liver enzymes and an ultrasound. So that's the reason that it's very recommendable go to the primary disease very frequently and have a complete blood panel that they can catch these things on time. When we are talking about absorption and digestion, the efficiency and integrity of the gastrointestinal system can change with age, affecting nutrient absorption. We have already talked about this, reduce the stomach acid. The stomach lining ability to resist damage decrease with age, and a drop of the hydrochloric acid production is very common. This condition, known as hypochlorhydria, impairs the absorption of critical nutrients such as vitamins B12, calcium, iron, which require an acidic environment to be released from food. Changing the microbiome, the composition and function of the gut microbiome shift with aging. So this can be lead to decreased levels of beneficial bacteria and increase inopportunistic pathogens and changes in metabolic function, such as lower production of short-chain fatty acids. These changes can cause inflammation that may contribute to nutrient malabsorption. Intestinal mobility. The muscles of the gastrointestinal tract can weaken and slow down with age. This can lead to slower gastric emptying, which affects appetite and longer colonic transit times, often resulting in constipation, intestinal wall function. So there are certain research that suggests that the small intestine ability to absorb most nutrients remains unchanged, mainly with age. Other studies indicate a possible decline in active transport process for specific vitamins and minerals. These The intestinal barrier integrity may also weaken, increasing the risk of inflammation. Aging impacts in nutritional status through physiological changes, reduce of appetite, altered digestion, sensory decline, and the increased prevalence of chronic disease and medications. This can lead to malnutrition, with increased the risk for weakness, immune dysfunction, poor wound healing, cognitive decline, bone loss, and mortality. Essential nutrients such as calcium, vitamin D, B vitamins, and protein become even more crucial by intake often declines, requiring a focus of nutrients-dense foods and addressing underlying causes, including social isolation, depression, and physical limitations. So what contributes to well-being? A healthy diet. Only contributed to physical health, and I will be remiss if I didn't at least mention these other lifestyle factors. No smoking is a given. Preventive care includes getting regular checkups, receiving recommended immunizations, and undergoing health screenings that can be detect disease and conditions in their early stages, as I mentioned before, like blood pressure, blood glucose, blood lipids, mammograms, and other cancer screenings, depression, hepatitis, and sexual transmitted infections. According to that's something I want to mention here is according to the latest data for the Center for Disease Control or Prevention, the CDC, nearly 1.1 million of people living with diagnosed HIV in the United States in 2022. Approximately 54% were age 50 and up. In addition, people age 50 or older are accounted for approximately 16% of new HIV patients. older Americans are more likely than younger Americans to be diagnosed with HIV infection later in the course of their disease. Diet and cognition. High adherence to the Mediterranean type diet may slow cognitive decline in aging. This is the only one diet that has substantial research, although there is currently no recommendation to adopt this style of eating for this purpose. There is more wishful thinking than credible evidence linking to variety of supplements to reduce risk of cognitive decline, like ginkgo biloba, multivitamins, antioxidants. Light to moderate alcohol intake may be associated with a lower risk for Alzheimer's disease. Still on the negative side, several studies have found a relationship between heavy alcohol use, including one study of binge drinking and cognitive decline among older adults. Although older adults have a lower incidence of binge drinking than younger adults, those who are binge drinkers report more frequent episodes per month, and also the amount they drink is greater, an average of 6 drinks, which the metabolism of alcohol being somewhat impaired with age. And because of the decrease in body water availability to dilute the alcohol, older adults have a lower tolerance. They are at greater risk for physical and cognitive effects compared with younger drinkers. Another trend for for these reasons, to including possible effect of cognitive function, is using. So a lot of people has up to using, and they can include a lot of things like chia seeds. For this is recommendable if you guys want to do it. There are some reliable sources that Alba Patricia is going to share with you. And thank you so much for being with us today here.
A question came in about intermittent fasting. If you could talk about that.
Okay. That is something that is very common, and even that's good that somebody was asking it. I'm reading the book about that one. A lot of people has taken it because they want to lose weight. So a lot of people is doing it, and it's according to the age group. That is one of the new like fashion that we have right now. A lot of people is doing it, and they trying to prolong the time that they're going to have the first eating. That's something that you need to talk to your primary doctor, because no everybody is healthy. So it depends on the conditions that the individual has. They needs to be checked, and if you can do it a couple of times, you can do it, but it's very, very in a one person condition, not for a full group of individuals, and it's according to the individual's health. Yes.
Hey, thank you, Nelly. Are there any questions? Any comments? You can drop them in the chat, or you're welcome to unmute yourself as well. Can you talk a little bit more about that Mediterranean diet and its benefits?
There is a lot of benefits of the Mediterranean diet. I mentioned that in the first session that we have. So why? Because this diet is one that prevents diseases, dementia and Alzheimer's, prevents any kind of cardiovascular disease, and is in the ingredients that the individuals use. This diet combines a lot of seafood that has high content of omega-3 that is very good for the brain. The brain controls everything in our body, so that's the thing. The food that is included in the Mediterranean diet is a dense food, and has a lot of vitamins and nutrients, and has nuts. The oil that is more recommended to use in cooking is olive oil, A lot of people has a few changes in that one. And individuals that are drinkers, they are allowed to have a little glass of red wine with this diet. So this has substantial research. If you guys want to check, University of Florida has a lot of publications with this one, and not only UF, the other universities nationwide has done this. And I think so that you guys going to have offer one of these webinars about the Mediterranean diet, Patricia, if I'm not wrong.
We have recordings of 6 webinars we've held, and I think we have scheduled one for October. We're still working out the dates, but we will post them on the WorkLife website once we have the date for that. But I'll post a link to the other webinars that are already recorded if you guys want to learn more about the diet.
Yeah, that is the only one that has substantial research.
What is a good source to learn more about the Mediterranean diet? So I'll post a link to those webinars on the chat. Unless there's like a book or something that you would recommend, Nelly. I'm not sure.
I don't want to recommend a book. There is a lot of stuff that we can find online and things like that. So even when you guys start to look for everything that has been published in a journal of medicine, and you can start to see all the beneficials. And if you are looking in essential things, like for example, you are looking for cardiovascular disease, there are beneficials of that one. And even is recommended to provide that kind of diet to children. So that means that during the development of the child, they're going to have significant prevention to cardiovascular disease as well, dementia and Alzheimer's. So this is something that has going on for quite a while.
Do you recommend that people over 60 switch out of their primary care physician into a geriatric practice?
That is depends of the individual. That is something of the, if you are satisfied with him and he is somebody that understands the changes that you are going through and has a substantial experience in that area, perfect. If you feel that is somebody else that needs to have more experience in that area, go for it. A lot of individuals as well look for a type of doctor that has homeopathic research because they want to try something that's homeopathic and they don't want to take medication. So that is only reference to the individual. Yes. It's like you guys, when we have kids at home and they just turn 18 and they're an adult. And I mentioned this one because I remember my child asking, Mom, I need an appointment with the dentist. And I say, yes, but now you are an adult. So your dentist, you cannot see it. You need to start to look at different type of dentist because you now are considered an adult. And the dentist I used to have, that was only for children. So yes, but there are certain stages in our human development that we need to vary it according to the state that we are on it.
Is there a resource that we can look at that will give us dates for when we need to have certain tests done? And they have like the example of like a woman should have like an osteoporosis test when it's a certain age.
Okay, that usually is provided by your primary doctor. And if according to the age of the individual, so yes, the primary doctor suggests that if it's a female, there are tests like there are certain mammograms. There are something that's only specific for females. If it's a male, male's going to have exams for prostate. And your primary doctor is going to start to tell you when those, usually we're talking about mammograms, they start to doing sometimes early, middle 30s, sometimes 40 years old. It start from there, and the doctor is going to tell you when they stop. like endoscopy, colonoscopy. It depends of your family heritage and how there are certain decreases in your family line. The doctors start to prescribe, okay, so it's recommended that you can have a endoscopy. It's good that you have a colonoscopy. So those are things that you need to talk to your primary doctor, and they're going to recommend certain extra tests according to your history and family history as well. Something that could be changed completely if for our life is somebody acquired a immunodisease, autoimmune disease, like for example, lupus. If that happens, your primary doctor is going to be send you to a oncologist and a specialist, and the the dropping of blood doesn't going to be one time per year, could be sometimes every 2 months, could be every 3 months. So, and you're going to have more specialists. It depends on how the lupus has affect your body. So that change, there are certain, there are a lot of autoimmune disease that affect our body different, and we are going to be to the different specialists, mainly oncologists and more specialist doctors through this. And this kind of tests can spend and could be more. Sometimes an individual can be in the doctor every month, every 2 months, 3, 4 different doctors. That varies according to the condition.
Okay, I don't see any more questions. So before we log off, Nelly, is there anything else you would like to share? Or do you have any other
Please,
webinars you would like to plug that you're hosting with IFAS alone?
I have a lot of classes I have done with you guys. We do all the disaster prevention and this in agent. We have more financial as well, sustainability, relationship parenting is one of my areas as well, food safety. So anything that you guys want to. And something I want to mention is go to your farmer's market, go to the place that bring products from the farm to the market in Gainesville, I know, and in another areas during the state as well, that you can go to have buy food, products, vegetables, fruits. They have high level of nutrients, and those are the best kind of food that we can acquire. Don't buy something that comes processed, and don't try to buy even the vegetables that come with the wrapping, trying to buy those as they come from the farm. Those are the best food that we can ingest. So trying to start to include that one. And when you go to buy groceries, buy vegetables and fruits that have different colors, because the nutrients that are in them benefits your body and your child and your family. So do that. Trying to homework, trying to buy something and taste something that you have not tried before to see if you like it. That is one of these. So go for those taste events to try to see something that you have not tasted before to see if you like it before that you're going to buy for it. Yeah.
All right. Well, thank you so much, Nelly, and thank you everybody for joining in. Enjoy the rest of your day. Thank you, Nelly.
Thank you. No, it's my pleasure. Thank you so much. Thank you.